Well, good morning, everybody, and welcome to the Pennie Community Work Group. My name is Chachi Angelo. I'm the Director of External Affairs. We have a really great presentation for you today. It's been a while since I hosted one of these, as our outreach manager is out doing outreach activities ahead of our open enrollment, but today is our Pennie Community Work Group open enrollment launch party. A few admin things to keep in mind. You're all muted. All attendees are muted, and if you have any questions, just pop those into the Q&A function. We're going to be going through a lot of information this morning, and we potentially could go over noon. So if you have something else to attend at noon, just know that these are always recorded and they're always up on our agency.pennie.com site, so you'll be able to catch up with anything that you missed. Today's agenda, a lot of people will be speaking today. We're going to have a message from our Executive Director, Zachary Sherman. I'll be going through some updates for you, everything that's kind of happening on Pennie's end. Hannah Turner, our operations goddess, I think that's her title, will be going through our system enhancements for both customers and stakeholders for the upcoming plan year and in our application. Our marketing communications specialist will be going over our open enrollment toolkit. I'll take back the mic and talk a little bit more about our communications timeline and how that applies to advertising and outreach. And then our social media coordinator, Bria Moten, will be discussing our social media strategy for open enrollment. So without further ado, I'll pass it off to our Pennie Executive Director, Zachary Sherman, to speak to the group. Go ahead, Zach.
Thanks, Chachi. Can you hear me okay?
Yep, sound good.
Great. Well, good morning, everybody, and thanks so much for the opportunity to be here, and thanks for tuning in. We have a lot of great stuff to go through today, so I'm going to be really brief. But I did want to welcome you and express our excitement about our kickoff here with the 2023 open enrollment launch party, and our excitement about the work ahead of us in terms of kicking off OEP, kicking off auto renewals, and going into opening the doors on November 1st for our 2023 open enrollment period. I want to say at the top and several times here that any and all success that we have in terms of trying to achieve our mission of maximizing the number of Pennsylvanians with access to affordable coverage is very much on the backs of all of our great partners, on the backs and the hard work of all of our great partners and stakeholders, working in your communities, working with consumers, spreading the word about affordable coverage, financial savings, and the pathway to coverage through Pennie. So thank you for all of your great and hard work up to date, and for all the work that you'll do in the coming months through open enrollment and beyond. We have quite a bit of great stuff to go through today. As Chachi mentioned, we're going to talk about the operational and technical improvements that we've made in advance of this open enrollment period. Team's going to take you through the 2023 stakeholder toolkit and talk about the different strategies we're deploying around marketing, communications, and outreach in the interest of trying to reach folks. Our focus in terms of who we're trying to reach is really, again, the uninsured, the underinsured. We're very eager to reach out to connect with underserved, marginalized communities, those who are qualified for low-cost coverage or even no-cost coverage, who just don't know about it. So we've been focused on breaking down barriers to access, barriers to coverage, trying to provide a smooth and easy enrollment process for both new and returning customers, and really growing and maturing our organizational structure and processes. One big thing that is really not a change, but it's a very, very positive thing, is that thanks to the Inflation Reduction Act passed by Congress and signed into law by the president earlier this year, the enhanced subsidies that Pennie customers have been accessing for the last 2 years will continue into 2023 and beyond. The Inflation Reduction Act extended those subsidies for the next 3 years, and that is going to bring a lot of stability and consistency for our customers. As you know, at the end of last open enrollment period, we'd signed up about 375,000 Pennsylvanians, with 90% of them, 9 out of 10 of our customers were receiving subsidies, which on average were about $500 a month. If not for the continuation of those subsidies, we were going to see going into next year an average decrease in the subsidy of about 20%, or more than $1,200 a year on average for those customers. So we're not seeing that. We're seeing a continuation of the subsidies, and a whole lot of stability and consistency in terms of access and affordability for our customers. So we look forward to building on the progress that we made last year, and connecting even more Pennsylvanians to quality coverage at a low monthly premium. Before I wrap up, I just want to make one more PSA, call one thing out, which is the public health emergency that has kept people covered through the state's medical assistance program throughout the COVID-19 pandemic has continued through this day. We expect it to continue until at least January of next year. There's a lot of speculation that it will finally come to close sometime in early 2023, possibly as soon as the end of January. And what will come with that is a process that the Department of Human Services will deploy, where they're going to rerun eligibility for everyone who's been held covered as a result of the PHE, and they'll start moving people who are no longer eligible off of the medical assistance rolls towards other qualified coverage, including we think a large number of folks coming to Pennie through the unwinding process. So that's going to be a very large and long effort of trying to facilitate people staying covered through some means, including through qualified low-cost coverage through Pennie. And again, it will take a whole lot of work from the people on this call and all of our partners and stakeholders moving in the same direction to try and make that work and trying to make it as seamless as possible. We've been working on a lot of things with the Department of Human Services to help make that process go as smooth as possible. And I think in future meetings, we'll dig into this a little bit more. But I just wanted to highlight, coming on the back of open enrollment, there may be another big enrollment related event that will require a ton of work to help keep a lot of Pennsylvanians covered. So in advance of that, thank you for your commitment and dedication to try and make the unwinding of the public health emergency go as smoothly as possible. So just wrapping up, thanks again for all of the work that you guys do to keep and to get Pennsylvanians covered. And I'm now going to hand it back to, I think, Chachi to kick off the regularly scheduled programming here today. Thanks so much.
Thanks, Zach, and thank you for your leadership leading into open enrollment in a very busy time of the year, and then what will be potentially a busy part of 2023. As some quick updates I wanted to run through, which is with our dedicated site for this work group is agency.pennie.com/Pennie Community Work Group, and that's where you can find all of our materials from previous work group meetings. And actually, this PowerPoint deck is now live on this site, so you can download that. And as you can see, as we go through, there's going to be plenty of links within that you'll be able to access going into open enrollment. So as just an enrollment timeline reminder, that we are currently still in the special enrollment period, with open enrollment starting November 1st. and running through January 15th. Of course, December 15th is the deadline for 1/1 coverage, and January 15th is the deadline for coverage for the rest of 2023. That would start on February 1st. Another reminder about our open enrollment customer service hours. So starting November 1 through January 15th, Monday through Friday, 8 a.m. to 7 p.m. Then we'll open up on Saturday from 8 a.m. to 1. And then Sunday we're closed. A couple dates to keep in mind for extended hours are the deadline days. Thursday, December 15th, 8 a.m. to 10 p.m. And then the last day of open enrollment will be open 8 a.m. all the way up until midnight. Some holiday closings to keep in mind. And then also we'll be open on December 26th and also the January 2nd as regular customer service days, 8 a.m. to 7 p.m. And then, of course, the customer line is 8040, and the assister broker line dedicated specifically to our helpers is 4440. If you missed our press release on the extended subsidies that Zach had mentioned in his remarks, it is waiting for you at the newsroom site. It was certainly a huge sigh of relief from everybody that works in this realm, knowing that these savings are continuing and Pennsylvanians are able to access these enhanced savings. So if you missed that press release, we encourage you to snag it and share it with your community. And again, I've already mentioned this before, but this is the webpage where all of our previous meetings materials are waiting for you. So all of them are recorded. All of the answers to all of the Q&As are there. If you had dropped a question and you didn't get it answered live during the meeting, it's waiting for you. And then, of course, the agendas and the PowerPoints themselves. Again, another reminder for the assisters on the call, there is an assister escalation pathway that's been updated for a quick resolution to whatever issue that you have. It is linked on this slide that you'll be able to get to and then be able to download to have whatever resolution that you're working through get to the resolution. And then the same for brokers as a reminder to make sure that you're calling the dedicated assister broker support line and working through the process of getting your issue resolved. There's the process there as well. And one last reminder before we start talking about system enhancements is to make sure that you're getting recertified and become Pennie certified for 2023. And those links are here. Remember, recertification deadline is Halloween. So those links to get certified as an assister and as a broker are waiting for you here on this deck, but very easily accessed at agency.pennie.com. And I will pass it off to our special advisor to the COO, Hannah Turner, to talk more about system enhancements for this plan year.
Great, thank you, Chachi. Go ahead, go to the next slide. Did want to do a quick recap and reminder that we did address a number of recent system enhancements in our September work group. Highlighted a few of them here. If you did miss the September work group, definitely should go check that out. In particular, I think we've already gotten a few questions around some of the functionality with that broker portal search existing customers. So we did walk through that in detail. Links there below and previously provided. But we did want to give an update on one of those items on the chat. Go ahead and go to the next slide. So we did implement a chat pilot program with our customer service representatives, and it's gone really well. We're really pleased with it. And so we have now made the chat available much more publicly and easily accessible on our Pennie.com page on Pennie.com Connect, or you can get there by going to support and connect, and that's where you'll see our main options for contacting us, obviously calling and chatting, and of course that local help brings the customer to a broker and assister search options there. So really excited about that and are looking forward to continuing that as we get into open enrollment with the chat. Go ahead and go to the next slide. So we did want to remind folks talk about the renewal process. So we're going to do a little bit of a reminder of kind of how that process works since we are underway at this point. So prior to open enrollment beginning on November 1st, Pennie goes through a process during October where we renew folks for the upcoming year. So who's eligible for these renewals? So we start by looking at anyone who's a current Pennie enrollee who's got active coverage at the point we start this process in October. And then first thing we do then is determine their eligibility for renewals. So we start by taking any of those folks who are currently enrolled, and we generate a 2023 eligibility application for them. And we do that by looking at using the information from their most recent 2022 application. And then we take that information, check our trusted data sources, as always. So there's a potential there they might have DMIs on their 2023 application. Follows the same rules as all other DMIs for checking for inconsistencies. One thing that is slightly different is that when we start eligibility applications for the new plan year, we do look to the newer federal poverty level tables. So starting with the 2023 applications, Pennie will be using the 2022 federal poverty levels, that's the most recent ones, for exchange eligibility. If you recall, back in April in our community work group, we talked about how in April, we started using the 2022 FPLs for Medicaid and CHIP eligibility, but Pennie continues to use the 21 FPLs for the 2022 plan year. So now that we're doing 2023 plan year applications, we start using the 2022 FPLs for exchange eligibility. So if you have any questions about those, I would go check out the April work group. We talked a little bit about what those 2022 FPLs are. So once we've determined folks' eligibility for renewals, then we will work on actually generating auto renewals for folks who are eligible. So we take any of those current enrollees and they get re-enrolled in the same or sometimes a comparable plan for 2023. We do apply 100% of their eligible APTC automatically to that renewal enrollment. So if you have customers who have previously only applied a portion of their maximum APTC to their enrollments during the year, we are applying the maximum to their auto renewals. They can easily go in and adjust that if they wanted to adjust it down. But every year at renewal, we will do the maximum of APTC. And then folks are going to start getting a bunch of notices regarding renewals. First two are going to come from Pennie. So we first send a renewal notice saying, these members of the household were auto-renewed, these members were not auto-renewed, why, etc. What 2023 plan they are auto-renewed into, and as well as the net premium for that 2023 plan. So their cost after any financial assistance. The second notice from Pennie is going to be their eligibility notice. So this is the same pretty detailed long notice that you get whenever you submit an application. It identifies the eligibility for every household member, as well as any DMIs that need to be resolved and the deadline for those DMIs. Those two notices will be released by Pennie the last week of October. You'll first be able to access them through the secure inbox by Friday, October 28th. That's our current schedule. And then if the customer has communication preferences electing postal mail, then they get sent in the mail and the customers will receive those, the following week, whenever their mail arrives. So those first two are the Pennie notices. Then the third notice that you'll get is actually from the insurer. The insurers also send their own renewal notice, talks about the 2023 plan that they are renewed into, include their premium, as well as all the details around any changes to benefits. So that's really important to check out. I do note here that our insurers do their best to be able to try to generate their renewal notices after we, Pennie, have completed the eligibility determinations for customers for 2023. That way the insurers can show the actual APTC that we've determined on their notice. But That's not always feasible just because of timing issues. So some insurers will only estimate a net premium on their notice. It'll very clearly say on their notice that it has been estimated, but regardless, you can always see the actual amounts of APTC and net premium on Pennie. So if there's any question about whether the net premium on the renewal notice from the insurer is estimated or not, you can always just double check what's on Pennie, and that's going to be the actuals there. Okay. So that's the renewal process. We do have a change to the renewal process for this year that we think is going to be really helpful to a lot of folks. Go to the next slide, please. When customers complete their application, they are able to choose whether to give Pennie authorization to check the trusted data sources each year at renewal to check their eligibility for financial assistance. Customers can say no consent or up to 5 years of consent. If a customer did not give consent, then when we get to renewal, we're not actually able to check the hub to determine if they're eligible for APTC. Last year, when we did 2022 renewals, these folks who did not give us consent to check the hub, we did not auto renew them. And that meant that those folks had to actively shop during open enrollment to be enrolled for 2022 coverage. What we've changed for this year is these folks who did not give us consent to check the hub, we are still going to auto renew them, but just with no financial assistance. So they're not going to get any APTC or CSR because we can't check the hub to check their eligibility for that, but we are still going to auto renew them. It'll just be at the full premium. So the customer still needs to take action if they want financial assistance, just come in and update their application to get that financial assistance applied, but they will have an actual auto renewal at that time. So this is a little bit of a change. We think it's going to work a little bit better for folks, and we are going to be doing a targeted outreach campaign to anyone who's in this situation where we auto renew them, but without financial assistance due to lack of consent. So we'll talk more about different outreach campaigns later on. So in addition to some changes to the renewal process, we do have some upgrades to the plan shopping experience for 2023. So first, you can see here, we have a couple changes to the plan display. So here in Harrisburg. So in Harrisburg, put in to the plan's shopping pages. Here's the 4 medical carriers I'm eligible for. You can see first right off the plan names, a little bit, especially these plans that have longer plan names, are now fully visible. So prior to this recent deployment, sometimes a really long plan name, you'd see like ... You have to hover over to see the full name displayed or look at the plan details. Now we've got a lot more room to show longer plan names, including much longer than these. And I think it's really going to help folks with their shopping experience. The other thing that you're going to see different on plan shopping pages is you're going to start to see this section on the tile for quality ratings. So the screenshots here are for 2022 plans. So I literally just went into browse for plans in Harrisburg and pulled these plans up. So you will start to see this overall quality rating appear on the plan tiles. For any of the 2022 plans, it's going to show up as not available, and that's because we haven't shown quality ratings for any 2022 plans, and we're not going to just change that in the middle of the year. But we are going to start doing that for 2023 plans. So let's talk a bit about what those quality ratings are. Next slide. So quality ratings, sometimes called quality ratings system, QRS, you'll hear sometimes, or star ratings. I think that's probably most commonly known. It's a standard developed by CMS to rate the quality of plans, and it's based on 2 types of measurements. One is the clinical measurements, and then also enrollee survey responses. And there's a lot of different reasons behind this. It's definitely intended to also help customers make more informed decisions, provide plans more, targeted information on how to improve quality, and other things. These measurements are based on a combination of things between medical care, member experience, and plan administration. If you are really interested in learning more about it, I've got some links here to the fact sheets and to CMS's information on all of the different underlying rating scores that go into developing that overall quality rating. But importantly, I want to call out that some plans are, even for 2023, are still going to show up as having not a rate is, a quality rating is not available. And that just means that the plan is either a relatively new plan or maybe just relatively low enrollment. So they haven't had enough data to be able to generate quality ratings. It takes a lot of data, and it takes it's about a 2-year process to develop those ratings. So there's a bit of a lag, hence new plans tend to not have ratings for the first couple of years. So just because a rating's not available does not mean it's low quality. It just means some of these other factors are at play and there's just not enough information to develop a quality rating. Okay. So go to the next slide and we can show what this will look like. So starting with the 2023 plans, you will see on these tiles here, and the overall quality rating, you will see the star ratings, and the quality rating is anywhere from 1 to 5 stars. And like I said, some plans, and even in 2023, you will see still will have not available because there's no rating available. The quality ratings are available on the plan tiles as well as plan details, and there's more a new filter option if people wanted to filter by quality ratings. Okay. And then one other update I want to provide around plan shopping for 2023. We have provided some enhancements that are going to make it easier for you to self-service report life events during open enrollment. So remember, once open enrollment begins, you have shopping for 2 different plan years. You could be shopping for 2022 or 2023 plan years, kind of in parallel. In fact, literally on the customer dashboard, you have 2 tiles at the top that say, 2023 or 2022. So when it comes to reporting a life event during open enrollment, first thing you need to do is think about the coverage start date that you're trying to enroll with. If you're looking for 22 coverage start date, then you would take the 2022 application, update the application, normal report a life event, and shop for a plan. That's going to be the same experience as you would have basically right now outside of open enrollment. If you're looking for a 2023 coverage start date, then you would update the 2023 application. If you're doing the shopping prior to 12/15, you actually don't really need to report a life event. You're just going to be able to shop with the normal 1/1 coverage start date without even reporting a life event. Where it gets a little more tricky is after starting on 12/16, when open enrollment would only give you a 2/1 coverage start date, but you might have a qualifying life event that you need to shop for a 1/1 coverage start date. So that's when you would need to, on your 2023 application, potentially report a life event to get those other effective dates that are different than the open enrollment dates that you'd be getting. So we're going to talk more about that in a lot more detail in the next work group for November, which is November 18th. But wanted to make sure we sort of set this up here since, you need to really start thinking about sort of the 2 plan year approach now. And then also to remember that because there are sort of 2 separate plan years that you're shopping for, you need to think through too, what change do you want to apply to both plan years? Pennie does not automatically take an enrollment change from your 2022 application and automatically apply that to 23 application. And that's because you might not want the same thing to apply to your 23 application. So if that's your intention, then you need to make sure to apply the change in both applications. So for example, if it's November 3rd and you've got a marriage to report, you need to add the spouse. You would start, because you want to get their coverage effective 12/1/2022. So you would start by going to the 2022 application, add the spouse, report the life event, and shop for that coverage for 12/1/2022. If you want that spouse to also be enrolled for 2023, you would then need to also go to the 23 application and add the spouse to the enrollment there. You could, however, maybe the spouse only needs the coverage for December for 2022. Then you would only enroll under the 2022 application and not make changes to 23. So just keep that in mind as you are processing these changes during open enrollment, that you really do need to think about both plan years and which coverage dates you're looking for and taking those actions under the appropriate plan years. So in the next work group, like I said, we're going to do a lot more detailed examples of these different life events that you might be reporting and how to get different coverage start dates and use this new functionality. With that, I'm going to actually hand it over to Kelsey Cameron to talk more about some of the other open enrollment activities.
Thank you, Hannah. Good morning, everyone. I'm Kelsey Cameron. I'm the Marketing and Communications Specialist here at Pennie. And today we're going to go over our Open Enrollment 2023 Stakeholder Toolkit. So next slide. This toolkit is for your use and access to available materials and templates to educate and communicate with customers and potential customers throughout the open enrollment period. The toolkit is accessible right now and can be found at agency.pennie.com/toolkit. And from there, you can find the open enrollment toolkit button that we have right there on the home page. And once you click that, it will download into a zip file of all of our Pennie branded materials. So what's included in the zip file is updated collateral for open enrollment, and that includes a waiting room flyer, Pennie palm card, a Pennie brochure, our perfect plan flyer, and then our general Meet Pennie flyer. And we have another version of that Meet Pennie flyer that is fillable. So that version, you can go in and add your logo as well as your contact information. All of these collateral materials are also available in Spanish on the zip file, and our waiting room flyer and our prom card are actually available in 9 different languages, which can also be found on this toolkit page. The zip file also includes some social media sample posts and graphics that can be shared on individual platforms with our hashtag, as well as some other digital graphics, animations, explainer videos. Those videos walk through the Pennie website. We also have new this year located on our resources page an English to Spanish glossary that we have translated of our typical Pennie terms and phrases that we have translated to Spanish so they're consistent. Our collateral material on our zip file can also be found downloaded farther down on the web page, the carousel. So you can also just do it that way, or you can, there's a button there as well as further down on the page, you can fill out a form for requested print materials. We do just want to make sure everybody is aware that it probably takes about 2 to 3 weeks in advance for delivery for those print materials. So get those in as soon as you can. And again, as of today, our toolkit is now available for open enrollment as we prepare for it. So I think we can keep going on to the next section, which is the communication timeline section. We can start by just going through a brief overview of our October and November items that we have. We have received our message testing from our creative vendor, which we are using for open enrollment moving forward. We'll touch on that later in this presentation. We are very close to finalizing our creative concept that will also live as an evergreen spot, but it's also a call to action for open enrollment. We have finalized our media buy plan. So here in mid-October, we are going to be doing our pre-open enrollment advertising. Again, we'll talk about this in a little more detail later on in this presentation. We today have officially announced our stakeholder toolkit is available, but we will be sending an email as a reminder closer to open enrollment. As discussed previously, the renewal and eligibility notices will be sent to customers late October, and our outreach team is conducting outreach to municipal leaders, county assistant offices, and faith-based partners. Then going into November, open enrollment goes live on November 1st. We will be updating our website for call to action language. Our social media campaign will kick off, which we'll talk about later too, as well as our open enrollment period advertising campaign and our earned media, which we're going to try to look to do a press conference close to the start of open enrollment, which will be followed by a press release. We will also be emailing and calling our various target audiences, which I will touch on in the next slide. And our open enrollment outreach events will begin in conjunction with stakeholder and legislative events, and our outreach team will be reaching out to connect to legislative town halls, community education centers, and health fairs. So I think that's it for the overview of the high-level timeline. And then on the next slide, we can kind of go through just this very high level of our outbound campaigns that we are doing to our potential and current customers. So we have two ways that we can contact our customers right now. And we do one through emails through our email marketing platform where we send email blasts. And then another thing that is semi-new this year for open enrollment is an outbound calling campaign. So we have customer service representatives that do courtesy calls to specific audiences, making sure these customers are aware of any updates needed to their application or any information they need to know particular to open enrollment. So I'll just go over this quick list of audiences that we have that we are prepared for. Stakeholders will obviously email our stakeholders, letting them know open enrollment is around the corner, notices have been sent. Again, we'll attach the link to our toolkit. We will also be emailing our stakeholders of any specific outreach to specific customers that we are doing, so they are able with all the information to provide assistance to our customers. And then the stakeholders will also get reminder emails for the open enrollment deadlines. Some specific campaigns to our current customers, emailing those with renewal notices that they can be aware that the notices are coming or on the way or have already came to them, and that open enrollment is around the corner. Some more audiences, customers who have not signed up to receive financial savings, as mentioned earlier, we'll be letting them know that they can visit their accounts and update accordingly. Customers who are seeing a more significant increase in premiums due to the insurer rates in their region, we'll be reaching out to those who are losing coverage plans due to either health or dental insurer no longer providing coverage in their region. We'll be reaching those who are currently enrolled in a bronze plan but are eligible for cost sharing reductions and should consider shopping up in a silver plan. We'll also be doing some outreach to those who have resolved 2022 data matching issue, but still need to resolve their 2023 data matching issue. And as we do for every open enrollment, we do weekly emails to our potential customers. We have their emails through because they opened an application or they've submitted an application, but they still need to go in and take those final steps to enrolling. So we'll be reminding them on a weekly basis, as well as reminding them on a daily basis of leading up to the deadlines, which we like to do a week before each deadline. So that's a pretty high level overview of our outbound campaigns that we're preparing for. And as things come up, we will of course be letting this group know of any changes. But I think that's it for now. And I will shoot it back to you, Chachi, I believe, to talk about our next slide for our message testing.
Thank you, Kelsey. Thank you very much. Having trouble getting off of mute there. Thank you for running through our communication timeline. And I think that flows really well into the language that we're using in that communication timeline. And, since we launched Pennie, we've been discussing with stakeholders, with vendors, and really trying to nail down the best way to talk about what Pennie does that can resonate with all Pennsylvanians. And earlier in the year, we did a digital survey with PA residents, and these would be our specific target audience, meaning over 26, the main insurance decision makers, and they were planning to shop on their own for insurance in the upcoming open enrollment. And this is significantly zoomed out. We had various demos and a lot of different methodology here. But for the purpose of this work group, I really tried to just give you the main headlines, which the resonating language when it came to cost was low or lower premiums really helped solve the customer problem. And savings also resonated there. So we were really leaning on savings and simple in that TV screenshot, as you'll see for our TV spot leading into open enrollment. Really trying to at least distill our message down to the simplest terms for anybody in Pennsylvania to understand the service that Pennie provides. And when it comes to customer service, keeping it simple, letting folks know that this is simple, that they can do it, that we make it easy to find help, And once you find help, it's going to be simple to go from uninsured to covered. And the other words that kind of rang true with our test audience here was when we're talking about the plans, high quality really kind of was the rose to the top. And also, you know, letting folks know that there is a broad range of plans that they can choose from to make sure that they're finding the best plan for their healthcare needs, but also for their wallet. And then we also identified some areas that we need to improve upon, which is still seeing the need to educate folks on the difference between Pennie and healthcare.gov, letting folks know that Pennie is their only option if they're looking for a place to shop, apply, and get the financial savings to help lower their premiums. And also what we've learned is folks are more apt to recommend Pennie the further that they go down the funnel. So if they've never gone to the website, they're less apt to recommend. But the further that they go and just check out pennie.com, maybe set up an account, maybe start an application. So the further that they go down the funnel, the more that the more likely they are to recommend Pennie to a friend, family, a coworker. So we're really trying to keep that as simple as possible in our advertising to let folks know, just go to the website, just check it out, just give us a phone call, just give us a phone call, just take that one little step through the door, and we promise that you'll be able to see how easy this really is. And we also saw that there was still not enough belief that Pennie can deliver those lower monthly premiums. And I think that that's an opportunity for our stakeholders to really use that toolkit that that Kelsey was talking about that is available now to help deliver that message that Pennie really is the source that can help lower their monthly premiums. And going back to the resonating language there, you know, low cost is kind of subjective, but lower monthly premiums solves that customer problem. And you being great community partners and stakeholders in this, really leaning on you to help carry that message forward. And in the next slide, we're going to be talking a little bit about our open enrollment creative and our media buy. So again, trying to keep our message as simple as possible, have some representation in our advertising to let folks know that Pennie is for all Pennsylvanians, and also speaking to customers where they are. So let's talk a little bit about the media buy. I've mentioned this before on board meetings and other work groups, that our media buy is going to be very robust with a healthy mix of traditional advertising and digital and lifestyle. So having all of the digital with paid search, social media, and inclusive of social influencers to help spread that message to their followers. TV, radio, transit, pharmacy, laundromats, captive audiences there. We'll be running advertisements during the Steelers and Eagles radio broadcasts, print ads, and we really are proud of our media buy with our print ads, because those really get to those publications that are instrumental in a ton of historically marginalized communities. So being able to get an advertisement to speak to that community in their specific language, we really worked hard to identify those publications and then get our advertisements in them to speak to those audiences. And also doing various event sponsorships, and we'll also be sponsoring a float again in the Philadelphia Thanksgiving Day Parade. And in our creative, you can see that we're really taking what we've learned from our message testing and putting them into the advertisements. So the purple ad there in the middle is a little bit of our teaser of the open enrollment is on the way. The other ads are speaking to the low premiums, high quality coverage, and simplicity of it all. And then, as I said, the advertisements that speak to people where they are. So the bottom here that says, see how much you can save before the next stop is inside transit. So inside the trains, inside the buses, and speaking to individuals where they are. The same for the same for inside of a pharmacy, letting folks know that get yourself and your prescriptions covered through Pennie. And that's really the mindset of our advertising is if you're able to speak to people where they are and deliver a very clear, crisp message, and also stay on brand with Pennie being approachable and easy and friendly. I think that we're really kind of hitting all of those points in our advertising and in our media buy. Going into mid-October with the teasers, and then into open enrollment. And then also for our TV and radio ads, the goal this year was to really be very descriptive of what Pennie is and what we do and how we serve Pennsylvanians, and have that be an ad that we can easily move into and use for our advertising for the public health emergency. So folks understand that this is what Pennie does, this is how we serve, this is the service we provide, and then be able to tag that same commercial and speak to those that are potentially losing medical assistance. So if I can just for a second, just give kudos to my team over in external affairs. They've really been working hard along with our vendors to make sure that we're trying to take this very complicated world of health insurance and distill it down to let all of our fellow Pennsylvanians know that, Pennie can make this simple, we can lower premiums, and we can provide that service and give that peace of mind to everybody. So just wanted to give a major kudos to my team on external affairs for carrying that ball forward. And speaking of my team, I'm going to pass it off to our social media coordinator, Bria Moten, to talk about our social media strategy.
Yes, so good morning, everyone. As Chachi mentioned, I'm the social media coordinator. My name is Bria. So this year, we're going to be placing a heavier emphasis on health literacy. As we've mentioned throughout this PowerPoint, we really want to drive home the point of Pennie makes it simple to get covered. We want to make it simple for people to be able to explore their options. And we really want people to know what Pennie is, what we do, and how we can help them save. We're also going to be continuing the Pennie in Your City event coverage weekly post that we do that just highlights which counties we are going to be having events in for that week, and we do that every week. And we're also going to be having certain members of the Pennie team go out to some of these events to sort of boost them on social media. We're also going to have a stakeholder spotlight to highlight some of the awesome work that our stakeholders and partners are doing in the communities, and a sign-up link for that will be going around to everyone who's interested later. And then these are the hashtags that we're going to be tracking. So Pennie Gets You Covered, Pennie PA, and Pennie OEP 23. So if you grab any of those graphics or that language from the toolkit, feel free to drop these hashtags in there. And lastly, just engage with Pennie. If you grab any of those items from the toolkit, just, tag us, and we are more than willing to amplify any of those messages coming from your guys' pages.
Thank you, Bria, and again, kudos to your work on our social media efforts, because again, meeting people where they are, scrolling along on their phone, and hopefully capturing their attention and getting some traffic over to the website and application to get them covered. So again, that social media, the social media graphics and text to make it very simple for you to just copy and paste right into your your personal pages or your agency pages or health center pages. We make it super simple to just download and move forward. So lastly, just wanted to give an update from our outreach team. Normally, Scott Yeager, our outreach manager, provides these updates, but he's outreaching right now. So happy to pass along the efforts that they're doing. Right off the top, wanted to thank our Pennie Assister Network for the help that they've been doing to help us cover events in Southeastern PA, which of course is our largest region of the state that has the higher uninsured rates. So that's really been a focus of ours, and it's hard for the Pennie team to be everywhere at all times. And the Pennie Assister Network has certainly been helping us cover a lot of events there. We've been connecting with a lot of different networks and community partners who serve those 55 plus demos, and letting them know that those enhanced savings are there for those that just don't qualify for Medicare just yet. Also, a very large effort was made in 2021 and this year in 22 to connect with hospitals and health centers to make sure that we are top of mind for the people that work in those hospitals and health centers, because that's where most likely somebody is to say the words, "I do not have insurance," so that they can easily pass folks off to Pennie.com, and also be ready and prepped for the unwinding of the PHE. Along the lines, as I mentioned, with our Pennie Assister Network, is our YMCA Health Equity Tour is going to be kicking off very soon with events in North Philadelphia, Erie's East Side, Hill District of Pittsburgh, and Pittsburgh, and in Dauphin County as well, with more tour stops coming along. And our the shift from last year's YMCA Health Equity Tour to this year is really making sure that we are kind of ingraining ourselves in lower income communities, the underserved, the historically marginalized, and the uninsured communities, so that the Pennie message is being delivered where folks are. Again, speaking to people where they are. And then continue to work with PA Career Links, small business development centers, and faith-based partners, and those organizations that are serving immigrants, and all throughout open enrollment and into next year with the potential unwinding of the PHE. So I think that we were able to get through this entire deck within the hour. So another kudos to my fellow presenters. If there's any questions that my fellow presenters think that we should address audibly, let us know. Or you can come off of mute and be able to answer those. And also a final reminder for, how you can contact us with questions and feedback is always welcome. Remember to direct customers to the 8040 line, but for our stakeholders, assisters, brokers, that dedicated line is 4440, and open currently 8 a.m. to 6 p.m. As I mentioned, the open enrollment hours are extended. And then if you want to just email that question, brokers@pennie.com or assisters@pennie.com. Pause there so we can scroll across the question and answer page and see if there's anything that we'd like to address. There is a question from Anonymous saying that local news stations are still running OE through healthcare.gov. That's actually a case-by-case scenario that I've run across, that if and when you see these local stations are still referencing healthcare.gov, that's an opportunity for us to educate that station, those station managers, those news directors about Pennie. And because it's not just customers that need a lot of education, it's also the media too. So
Hey, Chachi, it's Hannah. Sorry, there's a couple of questions that came up that we put in the Q&A that I think are worth just recapping for folks. One was questions about the notices, the renewal notices that Pennie sends to customers. Assisters and brokers will have access to all those notices through the customer secure inbox, and we'll be able to see, all of that information. So as soon as the notices are available in the secure inbox for the customer, assisters and brokers for those customers will have access to those same notices as well. And then another topic that came up in the chat, in the questions that we didn't really go into, but I want to call out here is that while the vast majority of the auto renewal activities that Pennie takes does occur in October, because we do that prior to the start of open enrollment, we do have a catch-up auto renewal process that we run in early December. And that looks for anyone who is a new household. Basically, it's for new households who have enrolled since the October renewal process and have not applied for 2023 coverage yet. We do run that in early December, but there are some scenarios that are not picked up in that December auto renewal run. So if someone, for example, enrolled in November of 2022 for the first time and then starts a 2023 application but doesn't complete an enrollment for 2023, that would not be picked up as part of the December catch-up auto renewal process because they've already started a 2023 application and they maybe just chose not to enroll for 2023. So it does, the catch-up process, renewal process that we do in December, does pick up some folks, but there are scenarios that are not going to, where someone will not be auto-renewed in that December process. So if you are helping someone enroll through Pennie for the first time after the renewal process is completed in October, please, when you're doing their 2022 enrollment, at the same time, if their intent is to enroll for 23, you should do that at the same time. Don't wait for the catch-up auto renewal process that we run in early December, just because there are some scenarios that will not be necessarily eligible for that process. It's best when you're helping someone to help them do it, the 22 and the 23 enrollments at the same time. Otherwise, there's been a lot of really great questions in the chat. We've not gotten through all of them. We will continue to work on those, and they will also all be posted after the meeting as well.
I was just scrolling through, seeing other questions that have come through. And if we do not get to those, oh, did you want to take one?
I was just going to call out one that was about the public health emergency and whether the end of the public health emergency would result in all Pennie customers having their eligibility redetermined. The answer is no. We will only be determining eligibility for people who have rolled off of Medicaid and are going to be coming into Pennie. You've heard us in previous work group meetings talking about the public health emergency unwinding and that is, we've been working closely with our partners at DHS and making sure that we have a process prepared for, when the unwinding begins. Once we have, that confidence that we have, yes, the PHE unwinding is going to start on this date, we will definitely be using this work group to talk about in detail exactly what's going to happen for these different populations of folks who are going through the unwinding, rolling off of Medicaid, what notices they'll be getting, when they'll be coming to Pennie, either automatically, when they'll need to actively come to Pennie, and a lot. So please don't worry about that. We will definitely be going through that in detail. We have not done that yet, mostly because we haven't had an official PHE unwinding date yet, and there's a lot of information we want to give you, but we want to give it to you when it's, about to happen. So when we do have that confidence about the PHE unwinding date, you will definitely be getting a lot of information about what that experience is going to look like in the next work groups after that. Thanks, Chachi.
Yeah, thank you, Hannah, Kelsey, Bria, Zach, for helping present today. And this deck is waiting for you over on our agency.pennie.com page, and looking forward to a successful open enrollment and prepping all of Pennsylvanians potentially for the unwinding of the PHE. So thanks again for everybody's for joining us today, and have a fantastic weekend. Oh, and one last thing, Pennie will be Pennie, our offices and our call center will be closed on Monday in observance of Indigenous Peoples Day. So have a nice weekend, everybody. Take care.